Let's talk fat grafting. Fat grafting involves harvesting fat from one part of the body, usually the abdomen or the inner thighs are the best donor site, and injecting it into another part of the body. And I usually describe fat grafting to patients as sprinkling grass seed. Some of the grass will grow and some of it will be blown away by the wind or by eaten by birds. And so we really can't rely on all of the grass growing that you plant, just like we can't rely on all of the fat cells surviving when we inject it somewhere else. Common areas where we inject fat would be in the breast, around a breast implant, in the dorsum of the hands to fill in volume that you're missing, sometimes in the face if you have facial wasting after weight loss or with age, and then other surgeons will inject it into the butt called the Brazilian butt lift. I don't do that procedure. What I tell patients is that we can really only rely on about 30% of the fat cells surviving, which means even if we inject a ton of fat into one area of the body, most of the fat cells will go away. So the results are usually disappointing. There is a problem with adding fat to a natural breast. As I mentioned, we can rely on only about 30% of the fat cells surviving, which means that up to 70% of the fat cells die. And when they die, particularly in a breast, they can calcify. And this can lead to abnormal mammograms, confusion about whether they are malignant calcifications, which can be a sign of breast cancer, or are they post-fat grafting calcifications. You can also develop oil cysts and areas of hard, dead fat called fat necrosis. And that can lead to callbacks after mammograms, biopsies, and breast cancer scares. So for most patients who are looking for a little bit of additional volume in their breast, I recommend a breast implant because implants are reliable, they are reversible, and a mammogram can clearly see where is the implant and where's the breast tissue. So I don't normally recommend adding fat to a natural breast.